Hello, welcome to Ben 7 YouTube channel. Today I will talk about CBT. It stands for Cognitive Behavioral Therapy, and I will teach you a little bit about what this is. Okay, so Cognitive Behavioral Therapy is about doing things that are out of your normal behavioral patterns. And by doing this, you'll gain a new perspective on how the world works. I have to mention, people love their habits and may just keep repeating what they have always done. This repeated behavior includes routines, habits, and patterns. It starts with your thoughts and results in emotions and actions. If you want to change outcomes and results in your life, new approaches are needed. Einstein put it nicely when he said, "The definition of insanity is doing the same thing over and over again and expecting different results." A person forms his thoughts based on what he or she experiences. If you ask yourself why you think a certain way, it's probably because of real life experiences. That's where you get the opinions from, your sense of the world. So we use the same mechanism to change people's beliefs by changing their experiences. Since these factors influence each other, meaning if we change one of our thoughts, the emotions and actions will often lead to a whole new chain of behavior. Cognitive biases are thinking errors. These are important because these includes errors like, for example, to think in absolute terms like black and white thinking or thinking other illogical ways. There are numerous thinking errors a person may have, and thinking in the wrong way doesn't represent reality, and this will often lead to failure. So search up cognitive biases or learn more about me telling you about it in another YouTube video. So back to cognitive therapy. It addresses cognitive biases and other mental flaws or thinking errors by focusing on your thoughts, by investigating them and asking questions to them. A therapist may ask you a question of what is the worst that can happen if you go and talk to a stranger, for example. And he may point out where we have what is called cognitive biases. In cognitive therapy, it is normal to talk about evidence to see results. For example, if you go up to a person and ask about how much the clock is, right? And the person smiles and tell you, then you have evidence that, okay, this is something I can do, this is okay. But if your evidence is a failure, then it's no surprise you think and act the way you do. By thinking and acting the same, the evidence remains the same. Did you see the loop here? So if you think that you can't go up to a stranger and ask for what time it is, you will not do it. And because you don't do it, it will become a pattern, right? So everything starts with a thought. The difficulty here is that it's hard for the individual to recognize their own thought patterns because they live in it. They see the world from inside, from the thought patterns. They believe it to be true, which is why they are in the first place. So watching behavioral patterns, which comes from thinking patterns, is easier. And this is something you could do at other people. So watching other people's behavior and then ask yourself, okay, why did he do this? Maybe he thinks like this. And then you start to see patterns of thoughts and behavior. And if you do this often to other people, then suddenly you will start to reflect or mirror this to yourself. And in this way, you can find out more about yourself. because behavioral patterns are something tangible and visible to observe. The most effective therapy is probably by doing both cognitive therapy and CBT. This means that you are both asking questions regarding your thoughts and doing behavioral missions out in the real world. Now, cognitive behavioral therapy focuses on changing your behavior to see new evidence. A person will often have a session with a therapist who point out where he can change his behavior. He gets certain missions to do, quote unquote. By doing these missions, you will get new evidence, and these new experiences will change the limited beliefs. The mind must believe what it experiences. And as stated, new experiences come from doing new things. But the trick is to be consciously aware of this. Most people will not try out new things consciously, breaking the habits if they have not been reflecting over the benefits of doing so. An example of doing a mission is to try to talk to a stranger and see what happens. This was the example I mentioned earlier. Another new behavior can be to say no to a person. While trying out these new missions, a person often has some tools available. Another example is one may learn some psychological tools that will increase the chances of success with influencing other people. So when you try out these techniques or new behaviors, if you then have tools and psychological principle, which I talk about a lot in this YouTube channel, by the way, hint, hint, it's a higher chance for you succeeding and getting better evidence, So if you can influence and you try out something new, you see that the other person smiles and gives you positive feedback. This positive feedbacks then will form your mind. See? Okay. So if talking to strangers has positive outcomes, one will now have new knowledge and tools for success. This will lead to greater confidence and self-belief. Better confidence makes your nervous system work more smoothly and your body language will be better. This again will lead to others getting more responsive and attracted to you. They will like you better. Cognitive Behavioral Therapy, CBT, is with other words experimenting with your behavior. By taking chances, you can succeed. But never taking chances is a loss. And I will talk more about how to take chances. And I will talk more about how to take initiative for social gatherings, for example. How to throw up a party, stuff like that. In another YouTube video. Another example in CBT is to choose to react in a different way. Instead of repeating the response in a similar situation, change your response. If you used to get mad, try diplomacy. If you are used to pleasing other people and that doesn't work, try setting boundaries. The important thing is to look at what works. The world works in terms of patterns. Now, try recognizing the patterns that are in play all around you. If you train your brain to watch for patterns in others, it will be also easier to see similar things in yourself. I mentioned this earlier, and I will talk more about this topic on how to be more unpredictable and how to change patterns in yourself in another YouTube talk. Moving on. Recognize that the average person may say Sue is like this or that, and they most likely don't use pattern. They don't talk about pattern in their speech. But when people describe each other, they are actually often describing patterns. And in this way, people are very predictable because people keep repeating what they are doing unless one works actively with CBT and cognitive therapy. And I don't think most people do that. But the ones who do, like you and me, we have the opportunity to change yourself and not be so predictable. And we can get more success and new experiences. If you work with these things in time, you will become more and more unpatterned, quote unquote. Another word for this, unpatterned, is freedom. So instead of becoming submissive when somebody is criticizing you, try to do something different, such as looking them directly in their eyes, straighten your back, and say firmly what you mean. This is a mission. This is an example of a mission to do. Just a cool, neat little things to do. It's your choice if you want to follow rules, quote unquote, rules you have in your head, or to have freedom of choices. The thoughts you keep repeating for yourself are the rules you are following. You are trapped in your own thinking and behavioral patterns. But if the just do it concept works for you, keep experimenting to just do things. And if it doesn't work for you, just do new things, just do it, face your fears and so on, you have probably hit resistance. And this is worth mentioning because this resistance is an emotional charge around the topic. It's in the word, it's something you don't like, it's something you don't want to do. And it's very hard to use your will to do something when you resist it. An analogy here is it's like driving a car with the brakes on. That's how resistance works. In these cases, it's important to release the emotional resistance. And you can also dissolve the cognitive blocks with cognitive therapy. I will talk more about how to release emotional resistance in another YouTube video. This is very exciting. It's very important actually. There are people in this world that have so much resistance because of what parents have yelled to them and criticized them in their earlier age. So when their boss tells them to do something, they get flashbacks from when their parents were criticizing them, and a lot of emotional resistance come up to the surface. And you can experience not getting anything done if you have resistance, you know. You don't want to clean your room, you don't want to wash your dishes, you don't want to pay your bills, you don't want to do anything because of resistance. And this is an important thing to understand. But as I said, this is for another video. Moving on. The important thing in cognitive therapy is to find nuances. Cognitive therapy is not to be confused with cognitive behavioral therapy. In cognitive therapy, finding nuances can be, for example, to understand that something that happens to you 10 years ago doesn't have anything to do with you now. Or the nuance that the person who did something to you was an idiot, it's not your fault. Or the nuance that you now have tools to influence and change the outcome to the better. Tools and skills that you didn't have before. So, it is a very important nuance that now we are 10 years older and wiser, so the chance of success are higher now. The goal is to feel good, to be in flow in all areas and situations. Therefore, identify when you get kicked out of state and work with these situations. The identification process is easy because you feel what is unpleasant. Everybody knows what doesn't feel good to them. The triggered situation is the target for cognitive therapy, cognitive behavioral therapy, and TRE, trauma release exercise, and other therapies. I will, by the way, teach you more about TRE, trauma release exercise, in another YouTube video. After you have released emotional resistance on a habit, you may also experience something that is called habitual avoidance. This is avoiding a topic because you have always done so, even if the emotional resistance is gone and your mind has not caught up. Creative avoidance can also happen, where you find creative excuses for why you are avoiding something. If you are rationalizing, meaning finding excuses, and often smart excuses for yourself, why you're stopping yourself from doing certain things. It may be creative avoidance. That's creative. Creative avoidance. Now, this is what I had to teach you today about cognitive behavioral therapy, and I hope some of this information helps, and I will talk to you at a later point. Bye bye.